Hello, everybody. It is February 18th at around 11 a.m. I was going to make this video yesterday and I was just too tired. Let's see, I haven't made a video in quite a few days. That's just because there hasn't really been anything going on. I've just been counting down the days, one day after another. But exciting news. So I went yesterday to my surgeon's office and surgery is officially on. This is the antiseptic body wash that I have to use right before the surgery. So everything is all set to go for March 2nd, and there should be no issues between now and then, I hope. He is putting me on a liquid diet the week before. Let me read. These are the instructions that I was given. For the week before, a liquid diet, approximately 1 week before, you will have 3 or 4 protein shakes a day, which is approximately 1,000 calories a day. And he said I could use skim milk with that, which is wonderful. The rest of the day, you'll be on a clear liquid diet. I can have any kind of clear broth, other clear liquids, Jello, iced tea, popsicles, Gatorade, which I don't like, Crystal Light. I can have any kind of the sweeteners, Sweet and Low, Splenda, Equal. I really should get some iced tea because I love iced tea. I've never really made iced tea though, and I don't like the instant kind. So my mom used to make sun tea. Just put the tea bags in the glass jar and set it on the porch. But of course, right now that is not a possibility. The day before surgery, I will be on clear liquids only, so no protein shakes. I call the Friday before, because my surgery is on a Monday, call the Friday before to make sure everything's all set, see what time my surgery is, what time I stop eating and drinking, medications, blah, 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 blah. And then, of course, here's the instructions for the body wash. Oh, I thought this was hilarious. At the bottom of this paper, I swear, it's right here. The very last thing on this paper. Wear clean underwear and clothing when coming into the hospital for your surgery. I'm amazed that they even have to print that on a piece of paper to hand to patients. I don't know. I just kind of think it's an obvious thought to make sure you wear clean clothes when you come to the hospital. I don't know. Let's see. Several weeks before the surgery, you stop birth control, you stop all your NSAIDs, aspirin, fish oil, any herbal meds. Call office if sick to get a new PCP clearance. Lord willing, that doesn't happen. Let's see. I'm just trying to give you an idea of what my surgeon requires, because every surgeon is different. I have to take my CPAP with me. That's about it. Let's see. The evening after surgery, you will be transported from the recovery room to the 4th floor, which she said was a beautiful area. I get to have ice chips and popsicles. Woo! I start walking around the room with assistant. I was hoping this wouldn't happen, but unfortunately, they're gonna cath me, which is natural. Of course, I expected that, but they leave it in until the next day, which, bleh, but oh well, it is what it is. Day after surgery, increase walking time, do ankle pumps. I have to do the spirometer, of course, to keep off pneumonia. The catheter will be removed. I start taking oral meds. And then, day of discharge stuff. And then at home, I'm supposed to continue short walks. I can use the stairs. Well, we don't have any stairs, but I can use the stairs. Walking prevents blood clots and reduces gas pain, which, for you that don't know anything about weight loss surgery, they put a bunch of air in your stomach. So after surgery, I've heard that actually most of the pain comes from the extreme gas pain from blowing up the area with air. Do the spirometer again. No lifting greater than 10 pounds, which means I can't lift my cat because she is definitely bigger than 10 pounds. The most important thing, of course, is to drink at least 64 ounces of fluid. That would be clear liquids, so I guess the protein shakes don't count. You begin protein shakes and multivitamins post-op day 3. Check for temperature. This is kind of embarrassing, but she said, since I'm having RNY, don't ever trust gas. She said, make sure that I go to the restroom if there's ever an urge to pass gas, because it is not safe to trust it. I think that's it. I see my PCP 1 month after surgery. I see this doctor, see my surgeon 2 weeks after surgery. And they'll tell me, all about what they want me to do from that point on. I realize some of you, I do have some subscribers that are weight loss surgery patients themselves. So if you want to just stop the video here. But I realize that there's probably some people that don't have a clue what goes on after weight loss surgery. So it is definitely a lifetime commitment. It is not a diet. It is not an easy fix. It is hard work. It just gives you a tool to help you. If you can easily bypass the tool. Not easily at first, especially the first 6 months, but you can bypass the tool. I know someone who came home the week or the day after her surgery, and she was eating potato chips. So that defeats the purpose. There's no reason to go through all of that and come home to the same old habits. That doesn't mean that people don't fall from time to time, make mistakes. And I will do that, I'm sure. I have no doubt. But the tool really does help keep you on track. There's 5 phases of the way that you eat. The first phase is all liquid, and that's clear liquids. That's like while I'm in the hospital. And then the 3rd day starts the full liquid with protein shakes, and then you add all the clear liquid plus the protein shakes. Then after that, generally, I guess it depends. I guess it would be, I'll be doing phase 2 until I see my surgeon at the 2-week point. And then after that, you move to a pureed type stage. That's like hot cereal, cream of wheat, or even grits. Let's see, what else? Oh, cream soups. You just strain them. You can't have any of the stuff that's in them, of course. And they should be low fat, low sodium. Let's see. I'm trying to think of other just pureed foods. Like you can cottage cheese, but you have to puree it. It can't be. It needs to be even smaller than small curd. And then after that comes the soft food stage. So then you can eat like a scrambled egg, or eat the cottage cheese without pureeing it. There's foods that don't hold shape, I guess, basically, is what you could think of as soft food. Then comes what would be the normal way of eating. Then starts your path that you're going to be on for the rest of your life. And that's just trying to eat protein first and your vegetables, Well, I guess the protein part is you just have to make sure that you get 60 to 80 grams of protein per day. Because keep in mind that weight loss surgery patients, especially the first year, can only eat a very small amount of calories. I read, and if any of my weight loss surgery friends are still on, please correct me if I'm wrong. I read that at first it's about 400 to 600 calories, if that, and then you don't go above 1,000 calories within the first year. And even after that, I don't think that you go above 1,000 calories. So it's possible to lose your hair, not all of it, of course, but it's possible to lose hair. That's one reason why I went ahead and cut my hair short right now, is because of the possibility of losing. You can take something called biotin to help, but all that does is, I mean, I'm sure it's wonderful, but what that does is it doesn't help keep you from losing your hair. It just helps grow new hair. What else? I can't think of anything else. Basically, it's not something to take lightly. I guess that a lot of people nowadays kind of think, well, they took the easy way out. They had surgery. It is not by any means an easy way out. I don't understand. I was telling Pete this the other day. I'm at 11 and a half minutes, so I'm kind of babbling, but I don't understand, to me, people who are like 50, 60, 70 pounds overweight going, and I assume their insurance won't pay for it because they don't really qualify, but maybe they go to Mexico to get it done, because there's a huge market for that. I don't understand altering your whole body and altering your, the rest of your life for 50, 60 pounds. I have to lose like 300 pounds. So that's worth, to me, making that lifetime commitment and altering my body and doing everything that I need to do to be able to do that. But I mean, everybody's to each their own. Everybody has their own struggle. I guess my point in saying that is it is a hard path. It is not an easy path. And there's oftentimes people have health issues years out, if you're not careful. And even if you are careful, it could just, something could just appear that you have no control over. So it's certainly not an easy path. That's all I'm trying to say. So anyway, if you have any questions, I'm happy to answer them. If you've ever thought about having weight loss surgery and you have some questions, I'm happy to help you. I know a lot about what life should be like after surgery. Obviously, I haven't experienced that yet, so I can't tell you from experience, but I can tell you from listening to others, watching others, doing a lot of research. So if you have any questions at all, please feel free to message me and ask me. I guess that's it. I'm already at 13 minutes, so I should cut it off. But anyway, I'm so excited. I will probably make a video the night before, let you guys know how I'm feeling, because I imagine I'm going to be pretty nervous. And then Pete's going to do some video for me in the hospital. Who knows how funny I'm going to look, but... So I'm a little bit nervous. That's probably why I'm babbling. I'm a little bit nervous because I've never had any major surgery before. So anyway, I hope you guys are all having a wonderful, blessed day. Try to stay warm.